Welcome everyone. My name's Stuart Windsor and I'm the Future Hospital Director here at University Hospitals Plymouth. It's a real pleasure to be here with you today to really start talking to you about the journey that we're on over the next 10 years to redevelop our healthcare estate here at Derriford Hospital and make it really fit for the future. So today what I want to do is talk to you very much about the first phase of our hospital rebuild. And really that's the phase of development that is going to be seen to rise from the ground, hopefully over the next 4 years. So that's where I'll focus today. Next slide. So really this is an opportunity to redevelop our estate, but also to reimagine how we want to re-provide healthcare for the population of Plymouth and the wider peninsula. So it's an opportunity really to reimagine our clinical services and make sure that we've got the infrastructure, both the buildings, the people, and all of the technologies to deliver that. So really this is about cementing our role as a specialist centre for the peninsula, but it's about growing us as an organisation to really improve lives here across Plymouth, Devon and Cornwall. The development here in Plymouth is one of a number that are happening across the southwest. Next slide. And it's really important that this is the opportunity for us to work together across the peninsula and the wider area to make sure that we have all of the infrastructure in place to really meet the demands of the population right the way across Devon and Cornwall for the future. It's very important, given where we sit in the peninsula, that everything that we do here in Plymouth and Devon is also aligned to the work going on in Cornwall. So really the new hospital programme does really give us that once in a generation opportunity to really change the face of our healthcare infrastructure across the peninsula. Next slide. This, I think, is a lovely photo. It was taken from one of the air ambulances coming in to the helipad, and it really gives an impression of the current estate. As you can see, the hospital's been built around the first phase of development, which is the H in the middle, the tower block for those that are familiar. And we've got a fairly tight, constrained site. So as we start to think about how we might rebuild that estate over a number of years, we've had to be quite innovative in terms of thinking about how we might go about that. What I'll do in the next slide is just show you some of the challenge in terms of the infrastructure. So the oldest part of the hospital is 40 or 50 years old now, and when you compare that estate to the needs in terms of modern healthcare, it is really challenging to be able to modify that building to deliver current healthcare standards. So this diagram really shows the area of the building which is the most difficult to actually convert, and it's ironically the part of the building that we work the hardest. So at the top end of the site near the helipad is our emergency department, and then most of our wards and our theatres are within the main tower block or the area to the back. We've got new areas of estate as well. So we've got areas towards the back, our Terence Lewis building, which is where all of our specialist services are delivered from. So really our challenge is, how do we deal with the oldest part of the site, which is right at the centre of the site? Next slide. You'll probably remember that a few years ago there was an announcement made about funding for new infrastructure, and there were 3 schemes that we were working on. The first was to build some new state-of-the-art imaging capability, 2-3 Tesla MRI scanners, and that project was designed to be at the back of the site in the Terence Lewis building, the newest part of the estate. And I'm really pleased that those scanners are now live and seeing patients. So that was the first of the major schemes delivered. The other 2 schemes that we've been working on over recent years really target some of the biggest clinical risks that we have within the organisation. The first is around the size and scale and capacity of our emergency department, and the second is around our hybrid theatres capacity, and I'll talk a bit about what a hybrid theatre is a bit later. So those 2 schemes were a mixture really of old and new build. So the areas in blue on here were new build. So the emergency department, we were planning to build a new build in the courtyard where the ambulances are, and then redevelop what was the current emergency department. The area at the back, in terms of hybrid theatres, we were intending to put a new building right in the centre of a light well. So you can imagine that has some difficulties in terms of access. And that was the only way we could create enough space to be able to deliver those additional theatres. So that was the plans as we were working on them. When the new hospital programme was announced by government, we took the opportunity to take a step back, because if you think back to the previous slide where I showed you the ease of conversion of the rest of the estate, what we were doing there was building brand new buildings, refurbishing buildings, but surrounded by a sea of old estate. So we wondered whether there was a different way of delivering the benefits of both of those schemes in a much more coherent way. So next slide. So what we've come up with is a scheme that builds a brand new building right at the top end of the estate, very close to the helipad and the main entrance, really to deliver the benefits of both of those schemes. That building will go on the site of where our children's theatres were. As a result of COVID, we've moved that activity into other theatres within the building, and therefore we've got a site there that's much easier to work with. We can demolish the current Plym building, and we've got a site then we can build a much bigger building whilst keeping all of the existing services running. So it's a much easier build than the two that we were proposing. Next slide. So this building is going to be a 4-story building, and the new build will provide all of our emergency department facilities. We'll have a real focus on same-day emergency care. All of the imaging facilities that we need to effectively diagnose at the front door will be embedded in that new facility or very close by. The new theatres that we were proposing will be there, and we've also taken the opportunity to add an extra story to provide even more theatre capacity, because that's one thing that we are short of. Obviously, the new build needs to provide all of the training, the support areas that go alongside the clinical services. We'll also take the opportunity to redevelop part of the existing emergency department for paediatric children's emergency facilities. So that will create a facility that is significantly bigger than the current facility. All of the plant will be on the rooftop, which makes it very, very easy to access and maintain, and we'll reconfigure some of the ambulance arrivals and drop-off areas, and I'll talk about that in a moment. I think what's important here is that the design that we've come up with is clinically driven, and it's been informed over now several years by best practice at a whole range of sites across the country. But really critically, it's been informed by listening to the views and the needs of our patients and staff. So we want to create a facility here that works for everybody and is significantly better than the facilities that we've currently got. Next slide. One of the beauties of building on the site at the top is that it allows us to work within the current access routes. So we don't need to impact the access roads. The helipad is right in the right place to be able to access that building. And we've got a site that's fairly easy to work with. Obviously, while that building is being built, there may be some needs to redivert some of the traffic as we go, but actually we end up with a site that's very, very easy to work with. Next slide. I'll talk now in terms of the building itself, and I'll walk you through each of the floors in a moment, but I want to start really by talking about how this new building interfaces to the existing. So over to the right on this slide, where the blue arrow is, that's the access route into the current hospital. And our proposal is that we create a new walk-in entrance very close to that new main entrance. The area in green on here will be the adult emergency department, and the area in sort of the pinky orange will be the paediatric, the children's emergency department. What we've done is really separated now our walk-in entrance from our ambulance entrance, which will be round really where the current emergency department courtyard is. So we'll come in through the back for all the emergency ambulance admissions and those coming from the helipad, and there'll be a separate walk-in entrance. So that segregation is really important. It will also allow us to stream patients into the children's area really effectively. So we've thought about how this will actually interface to the current building. Next slide. So on the ground floor is devoted to the emergency department, and as I said, the existing department will be converted into a children's department, and that will be significantly bigger and better and brighter than the current facility. The area at the front in the new building will be focused on where we treat the sickest patients. So there'll be the area where the ambulances come in will be very close to the resuscitation area, whereas say that the sickest patients go. The area at the front where we've got the walk-in entrance will provide rapid assessment before we then stream patients to the correct area within the department. So that whole of the ground floor will provide a much bigger, much more spacious emergency department. You can probably see from the way that it's set out in terms of the number of cubicles, it will make a huge change in terms of privacy and dignity for our patients. So much more light and airy space. Next slide. The next story on level 7 will continue the emergency care journey. And this is where we intend to put in place same-day emergency care facilities. So a lot of the patients that come in through the front door could be turned around and sent back home fit and well within a 24-hour period. Because of the constraints on space that we have, we tend to admit a lot of those patients currently, which is not great for patients. It's not great for our ability to then provide services across all of the specialisms. So we want a real focus on diagnostics at the front door, and then making sure that where it's possible to send people home safely on the day that they come into the emergency department, we do so. So there'll be an increased amount of chair-based assessment spaces and really private consultation and examination spaces that are provided on this story. What we're also doing here is providing a 24-bedded short stay ward that will have specialist frailty facilities. So that will allow us to keep, before we admit fully into the hospital, patients where we think with appropriate treatment and appropriate care back in the community, we can discharge early, and that'll be very important. We're also taking the opportunity here to embed all of the imaging that we need to support the diagnostics that go around rapid diagnostics. So that will be a very important part of the jigsaw. So in terms of the next slide, the next story, the level 8, will provide our interventional radiography facilities. Now, these are very specialist theatres. They are theatres where the surgeons operate guided by imaging. So they combine both having imaging in the theatre suite and the ability to do the operation simultaneously. Those will be 5 facilities on that level and a recovery area. We've also taken the opportunity to build a link into the hospital at level 8 because some of those patients will then need to access the main hospital. Next slide. The last area on level 9 allows us to put 5 new operating theatres. So there are 4 interventional theatres on the lower floor, 5 theatres on the top floor, and these will be a range of theatres. They'll deal with emergency surgery, but they'll also allow us to do some other surgery in those theatres as well. This story will provide more administration and support areas, welfare facilities for the teams that will operate out the building. What we've tried to do in terms of the design is focus the areas where we have patients staying with us for a reasonable amount of time to the far north of the building. So you then look out over the helipad and over to the north over Marjons. So you get the best views and you get the best amount of natural sunlight. We've then in terms of the the way that the flow works, we've tried to keep the areas that don't need natural light back close to where the existing building is. So next slide. So I want to just give you the image in terms of what that building may look like. There's a lot of work to do in terms of the design, but it shows really the scale of the building compared to the tower block in the back. So just to think about the kind of scale that we're proposing here, that building will be of a similar size to the Terence Lewis building, the new extension that provides our cardiothoracic facilities at the back of the site. So it's a fairly significant building. And I think that will change very much the face of Derriford. It will be the front gateway into Derriford. That then forms part of plans that we'll be developing over the next few years that look at how we transform some of the other services that we provide and what we need in terms of infrastructure, both here on the Derriford site, but also in the community. So I will leave you with the last slide, which is really the opportunity for you to share your thoughts in terms of what we're doing. We've listened to a lot of views so far, and this will just provide you with the opportunity to feedback. And we're really, really keen to get your thoughts in terms of how you think the building looks and feels and the things that we ought to consider. So thank you very, very much for listening, and I shall see you hopefully in person very soon.